Research has shown that in as little as 2 weeks of taking a substance like that, you can form a dependency. One of the things that happened in recent times, as a matter of fact, is people, lots of young people, when they were either kids or adolescents, have had their wisdom teeth removed. And at the beginning, when all that was happening and people were going in for dental surgery, they would then get prescribed an opioid after that. So you're having your wisdom teeth removed, you're in some pretty considerable discomfort, and you start to take an opioid. And research has shown that in as little as 2 weeks of taking a substance like that, you can form a dependency. And then you find that you actually, when you stop taking it, you have this real feeling of withdrawal. And the feeling of withdrawal and the fear of withdrawal is one of the primary problems with addiction. I've talked to so many addicts, as mentioned, over decades of time. And one of the things that they experience is they're so afraid of not having the substance on which they're dependent. Because the feeling of withdrawal, you imagine what withdrawal is like if you're taking an opioid or alcohol or a benzo or something like that that forms a dependency, and then suddenly you don't have it and you go into that hard detox. It's really uncomfortable. So, it's important to point out that, when you take some kind of dependency creating substance, the addiction can be developed in as short a time as a couple or a few weeks. And the anxiety about that can itself be something that is motivating in terms of using the substance more often or more frequently. So, yeah, it's really a complex human situation that, we certainly continue to struggle.